Good morning, students. Environmental studies and health. In previous class, we had been learned that health sector responsibilities on environmental health. Then ICN, International Nursing Council, voice to attain sustainable development goal. Today, the environmental studies how to help us to promote health status of people. It is a specialty in healthcare is that environmental health, which means health of environment, mainly pollution free, hazards free, etc. In my MPhil thesis, I was conducted research on WHO, and that thesis I was separate heading, content, environmental health. The WHO has been working separate department for improving environment. The reason is that environment and health directly linked with each other. Good environment promote good health. Detail going on. Overview. It is a branch of public health. Natural bullet environment affect human health. Preventing illness is environmental modifications can prevent illness. And harmful injuries by means of environmental hazards. Okay. Next, globally, 23% of all death, then 26% of children age under 5 affected death are affected by the environmental factors. These factors are diverse. The place to place, region to region is different. Then hazards are mainly hazard substances in air, water, soil, food. The natural and technological disasters. Define environmental health. WHO defined that. First need to know about what is meant by health. Okay, WHO defined health. Keywords: complete state of complete physical, mental, social well-being, not merely absence of disease or infirmity. Well-known definition. Then define environmental health. World Health Organization stated in 1992, it comprises those aspects of human health, including quality of life, that determined by physical, chemical, biological, social, and psychological problems in the environment. It also refers to theory and practice of assessing, correcting, controlling, preventing factors in the environment. So if correct, control the environment, we can prevent the diseases. Then potentially adversely affect the future generation as well as present. Look at this, top 10 causes of death from the environment. First, stroke. Second, ischemic heart diseases. Already we had been learned this. Third, unintentional injuries. 4, cancers. 5, chronic respiratory diseases. 6, diarrheal diseases. 7, respiratory infections. 8, neonatal conditions. 9, malaria. 10, intentional injuries. So these all this. So due to environment. Next section, principles of environmental health. Health is linked to quality of environment. As we have discussed, the air, water, soil, food, products free of potentially harmful chemicals. Which means away from hazards, harmful. 3, healthy environment is universal. Students, it is a fundamental human right. Everyone should be right to protect the environment. Then environmental and social justice. Population and assumes that health are not acceptable. So environmental and social justice, right of all populations. Next principle, fifth one, pollution prevention. The pollution prevented at the source, not only individual do, every individual, every institutions identify which is the source of pollution, try to control it. Not secondary source, first source. Sixth one, healthcare have an obligation to address health disparities. So we are healthcare professionals only responsible to, which is the main source of pollution and hazards, and identify, address it, advise to, and report it. Environmental injustice. 7, healthcare professional collaborates with professionals and policymakers, advocacy groups, and local, state, national, as well as international effort to meet health needs. So healthcare professionals, mainly we are nurses doing fundamental role as we have discussed. They identify the source of the pollutions in the communities as well as the individual levels, identify their knowledge and try to in every level to prevent pollution, promote environmental health. How the environment impact our health. Look at this. Air pollution, water and sanitation, inadequate chemicals, radiation, community noise, sound pollution, occupational risk, agricultural practices, built environment, then climate change. Then promoting health, promoting sustainable development. So if improve the environmental health, health is a environmental modification is one of the important tool of promoting health. If promote health, we can achieve all sustainable development goals. Then relation between health and environment. Look at this. This is environment, abiotic, biotic and socio-cultural. Students, so this is a key. Social factors are responsible for biotic and abiotic environment. Social, we are people. We the people can control the environment. We only make damages to the environment, for example, physical environment. Damages, pollution, air pollution, cause to affect physical health, also cause mental illness, and which leads to social disabilities. Also, the people also responsible to biotic environment and protect the other biological, mainly this plant, animals, and protect dangerous species, which help to promote. Also, this physical environment may be damaged. The biological environment always affected mainly microbiology. Microorganism has been changed. Their chemical bond, mainly bacteria and virus, which cause new kind of diseases, viral and bacterial. So this is a reason why environment and health versus health directly linked with. We the people, social, we have interact with each other and interact with environment with friendly, which help to promote physical health, mental health and social well-being. Then physical hazards and their advance health effects. Mainly temperature, temperature rise, climate change, increased mortality and physical hazards. Students, we need to think about climate change. For example, agricultural sector largely affected, or this farmer suicide in various states in our country. The reason is that change. The farmers expected rain, but the rain not that in the season. Change. And in the winter or summer there is heavier rain, which cause to damage the agricultural, the productivity, and farmers suffer a lot. Then physical hazards. electromagnetic radiation, ionizing radiation. Then soil also affected by these physical hazards, toxic substances, mainly that the chemical fertilizers damage the healthy soil, as well as chemical pesticides damage the air. Then chlorofluorocarbons, do you know that use in the ACs? So nowadays not allowed to this chemical refrigerators damage the ozone layer. So nowadays not allowed to use this. Then chemical hazards. Then chemical oxidation. Then urban airborne pollution. As we know that industries in urban, when you the land in this Chennai or Mumbai, just look upwards, we could see that various industries emitting this air pollutions as well as cause dangerous. Nowadays reducing, the various government taken various measures to prevent emitting the poisonous gases as well as which prevent air pollution. The mainly concerning airborne diseases in the urban areas. Then waterborne diseases. Then biological environment and health. Hazards, biohazards, biological substances, threat to the health. Then medical waste, microorganism, virus, toxin. Students, we are nursing professional need to concern this. Okay. Nowadays in every hospital having medical waste management, we are nurses responsible to correctly manage the waste. Different colors use the packets to keep that materials and safe, mainly bio waste. Then biological hazards, bacteria, virus, insect, plant, bats, animals, humans. Health effect from skin irritation, allergies. One of the disease example tuberculosis by means of airborne diseases. AIDS by means of these biological hazards, for example, the improperly use of the blood or fluids and others biological waste in the hospitals and other places. Then social, cultural, environment and health. Socio-economic status, poverty, job, stress linked to health. Socio-cultural already we had discussed. Social means people how to interact. Better interaction and away from social disabilities, good socialization help to better health. The cultural concern two types of culture, material cultural traits and non-materials. Material is a key. Nowadays, modern technology may be properly using. Next is that non-material, including belief, values, as well as the mainly concerning the mental illness due to superstitious belief or wrong belief towards the religion as well as self, which is a kind of culture, which cause the mental illness, which is directly affect physical health. and also leads to social disabilities. Then psychosocial work environment. So this is very important one. Various issues in this social environment due to lack of psychosocial factors. For example, workplace stress, due to lack of interaction, the crisis between the the workers, even in hospitals, which cause cardiovascular diseases, musculoskeletal disorders, etc. Mental illness. Then race and ethical, gender, sex role, family. Then education, occupation. Then social support network is needed to overcome the socio-cultural issues. Then psychological environment also determined by income, social unity, capital, collective efficiency, social determinants of health. Then environmental studies and nursing. Overview, environmental health and nursing. Students, these various theories in nursing. Every theory emphasizes that environment is first factor to provide better nursing care, environmental oriented care and cure. Nursing specialties. Florence Nightingale, first rule of nursing. Every nurse should be keep it your mind and should be conceptualized. Keep the air within a pure as the air without. So this is a Florence Nightingale theory emphasis that environment is first, mainly air is quality is need. In 1859. Define nursing, already we had learned this, collaborative care, promotion, prevention. Then safe environment, shaping policy. Students, this point is very important. Nursing responsibility to promote safe environment. Then role and functions of nurses, communicator, teacher, client advocate, counselor, change agent. Change agent should be keep. This any changes in the environment should be identified and advised to advocate, case management, manager, researcher, clinical specialist, practitioner, midwifery, anesthetic. These are the role of nurse in specialized role, educator, entrepreneur, administrator, and prevention of diseases, rehabilitation. Every role and function should be environmentally sustainable. Then principles of environmental health for nursing practice according to ANA, American Nurses Association listed. What are the principles of environmental health for nursing practice? Okay. First, knowledge of environment health concepts is essential to nursing practice. Okay. Mainly environmental knowledge, technical words use, which is used in the environmental science. For example, biological environment, maybe technical word is that biotic environment. abiotic like this. Technical words should be keep. Then second, principle guides nurses their practice to use products and practices that do not harm human health or the environment. What do you think about products, nurses using different types of products? In every nursing practices, different materials use, medicines use. So should we think about that harmful to environment as well as and try to take preventive action in the face of uncertainties. Third, work in an environment that is safe and healthy. Right to work. Mainly community health nurses visit every families and groups in the community and organize various programs, promote, modify environment and prevent the diseases. Then, sustained through multidisciplinary collaboration. In the collaborative practices, nurse is a fundamental, nurse need to coordinate. For example, when do communities, they coordinate the educational sectors and agricultural sectors and other sectors and try to discuss about the environmental issues and try to overcome it. Then choice of materials, products, technology and practices in the environment that impact nursing practice based on best evidence available. So maybe we have some new materials or any new products and practices may be given models. That time need to want to like to ask evidence to which any harm, then only you need to do practice in clinical level. Mainly in medicine, some medicine as well as some products in the use in this nursing procedures. Then approaches to promoting a healthy environment. Mainly respect the diverse values, belief, culture. Students, we are nurses not only concerning the care and blindly. First, think about belief of the people and culture of the people and values, diversities, belief-oriented care, cultural-oriented care. And that time only we can identify what are the materials harmful and affect the environment and try to educate the people and away from these hazards and promote health by means of environmental modification and adjustment. Patients and their families. 7. Nurses participate in assessing the quality of the environment. Quality of environment measures by various devices nowadays available in modern technology. They are air quality as well as water quality. Just imagine, for example, nowadays this visit every villages and take samples and advise to take samples and conduct the test water quality as well as air quality by the nurses in community level. Then timely information. Healthcare workers, patients, communities, right to know relevant timely information. potentially harmful products, chemicals, pollutant and hazards to the exposed students. The nurses doing fundamental role, mainly individual level as well as community level. Individual level in clinicals and community level in the villages, public health centers, village health centers, visit families and collect the data. Any product harmful. So first know about what is the main cause of particular disease and identify the cause, the environmental causes and advice to and authorities. Information give to higher authorities and take immediate action to prevent the hazards. Nayan, welcome back. Nayan, nurses participate in research or best practices that promote a safe and healthy environment. Mainly, specifically nurses have been conducting research on environmental health. Also support the other sectors research, for example, agriculture and educational sectors and environmental. Support to collect data regarding environmental factors. Ten, must be supported. Advocating and implementing environmental health. Mainly health practice principles in nursing. So these are the 10 principles of principles of environmental health for nursing practice according to American Nurses Association. So this is a first unit is a key for us. So this unit we had been learned about types of environment. Detail about types, we had lot of knowledge. What is mean by biotic? What are their classification? What is mean by abiotic or physical? What are their classifications? Then we had been learned that the relation between health and environment, health and nursing. The mainly various institutions set, mainly ICN, International Nursing Council, a set a voice to raise to promote sustainable development in nursing practice through nursing practices. and health. Every health key factor, every diseases key factor is that environment cause that disease or conditions. Next, review questions. Environment. Define following: environment, environmental studies, environmental science, ecology, physical environment, atmosphere, biotic environment, sustainable development, environmental health. List the following: types of environment, composition of atmosphere, types of biotic environment, types of microbes, then short notes. Multidisciplinary nature of environmental studies, scope of environmental studies, then importance of environmental studies, need for public awareness of environmental studies, then types of environment, objectives of environmental studies, environmental studies and sustainable development goals SDGs, environmental studies and health, environmental studies and nursing, principles of environmental health for nursing practice ANA, essay on define environmental studies, explain types of environments, its impact in health and nursing. Students, this is assignment on this unit. There is no unit test for this. Okay, only for assignment this. So next unit was allotted for me is that social issues and the environmental. Is able to see that unit 6 social issues and environment. So this is a interesting unit. The reason is that we can learn from what are the real social issues due to environment. First is that from is a learning objectives. First, this unit we are going to learn about from unsustainable to sustainable. So this section will be detailed about what is sustainable, what is unsustainable, which this year we can from this stage to that stage, sustainable to unsustainable. Then urban problems related to energy. Next, water conservation, rainwater harvesting, water seed management. So water is a major issue. Next, resettlement and rehabilitation of people. Its problems concern. Various case studies given here. So this is other problem. For example, modern developed world, industrialized society. The nature was destroyed. Settlement, people living in particular area. The resettlement due to industrial development and growth. Next, environmental ethics, issues and possible solution. Then climate change, global warming, acid rain, ozone layer depletion, nuclear accidents, Holocaust, and some case studies. Wasteland reclamation, consumerism, waste product. Then next is that Environmental Protection Act, different legislation. We are going to detail about it. Then Air Act, Water Act, Wildlife Protection Act, Forest Conservation Act, issues involved in enforcement of environmental legislation, then public awareness. So these all we are going to learn in this unit. Very briefly, first section is that in this unit, from unsustainable to sustainable development. What is meant by unsustainable? Unsustainable development occurs when present progress is at expense of future generation, which means present activities damage future or by means of pollution hazards. For example, a responsible planning. Government planning as well as non-governmental plannings damage the environment, degradation. Then damage the ecosystem, which is called unsustainable. Next, sustainable development, which means economic development conducted without depletion of natural resources. So every development planning first concern is that environmental protection. We can use the natural resource, but which do not affect future as well as present generations, and do not harmful to future or the environment. See, definition available: development that meet the needs of the present without compromising the ability of future generation to meet their own needs. For example, now we try to satisfy that need by means of various programs and policies and planning, and use the natural resources to fulfill present needs, but not that activity do not damage the nature. Should we preserve the nature and plan to use to satisfy present needs, which means sustainable development. What is true sustainable development? Optimum use of natural resources, or a high degree of reusability, which is very important. Okay, students, we can use the nature and as well as reuse. Minimum wastage, least generation of toxic, which is other important point. Do not hazards air, water, then by products and maximum productivity, which is a true sustainable development. Next, unsustainable to sustainable, some historical evidence are there. Economic growth not bring about a better way of life for people unless the environmental conditions. Due to water pollution, other types of pollutions cause this by means of development programs. Equity issues, equality of using the resources, disparity in the lifestyle between the rich and the poor, and unsustainable development strategies. For example, developed countries use maximum resources and energy, which may damage the environment, which affect the poor as well as developing countries. Mahatma Gandhi says that village community based on sound environmental management and stressed on sanitation, recycling, well ventilated. What is my ventilated? That time Mahatma Gandhi used that word, which means pure air and roads bring clean and free of dust. No, street should be clean. Objective was villages made goods instead of industrial products. Long-term development, not short-term. Gandhiji had designed a sustainable lifestyle, a growing realization of the development strategy. Unsustainable development strategy. Development will not destroy the environment. So society should be changed. Okay. Unsustainable development strategies. So any development program first concern that program sustainable or unsustainable. Unsustainable means only short period, for example 1 year or 5 years only. That impact may be 10 years and lifelong impact may happen. So should be concerned that. And sustainable lifestyle, individual practices, care for the earth. Every individual give to earth. The new concept of development has come to known as sustainable development. Students, the fact is that in the beginning of government development programs, they don't think about the environmental factors. Just imagine the agriculture, in 10 or 20 years back, every farmers use chemical products, chemical fertilizers, chemical pesticides that damage So that type of planning is that unsustainable. They don't think about environment. What are the damages will cause the future? So nowadays, concerning new concept, sustainable development. Now agriculture has been changed. The farmers use rationally the chemical fertilizers as well as pesticides. Nowadays change the biofertilizers and biopesticides, which is sustainable and lifelong better yield. So, and there was the issue of at the Rio conference in 1992. Several document United Nations Conference, Environment and Development, fact that environment and development are closely connected and that are need to care for the earth. Is defined as to meet the needs without compromising. Already we have discussed this. It also look at the equality between countries. In sustainable development, concerning the equality between countries, we have discussed that. Not only among the country as well as within the country, including between races, for example, tribal people and urban people living in the nature. But new project may come in the tribal area. Development project, they destroy their livelihood in urban area. As well as classes, gender, ages, equality should be maintained. Then economic opportunities. Social development, inclusive economic opportunities based on improving quality of life for all, especially poor, deprived within the carrying capacity of supporting ecosystem. Next. Process which leads to better quality of life, reduce the impact on environment. Strength acknowledges the interdependence of human needs and environmental requirements. So quality of life concerning environmental friendly. Then project, every project looks at sustainable development, and new project government has made it compulsory to publish the summary of report of environmental impact assessment. Students, this is important concept and need to conceptualize EIA, environmental impact assessment. For example, one project started or in a particular village. That project, for example, road or particular industry, that particular project or development project, how much impact on the environment? What are the environmental factors affect? How many physical? For example, air quality, then soil. This assessment should be conducted the government and report it. Then only they give permission to start that the development projects. Then public hearing is needed. Public hearing means ask to their inhabitant. For example, a particular village, a new project may came. For example, the airport may become in the particular village. They occupying this land. A lot of people may be resettlement. That time, old environment affect and livelihood affect. So people hearing first ask the people this opinion, then evaluate, respond to public hearing. Then possible to impacts of projects. So the project managers, they explain about that project and what are the benefit of that particular people, groups of people in that particular village or that livelihood, etc. Increasing a citizen of one common future at the global level must constantly monitor the pattern of the development. So which means every citizen right to monitor the pattern of development. A particular development harmful to the environment, right to protect and right to ask. Life has to be made more livable for all, which means away from hazards. So which means sustainable to unsustainable. I was given excellent illustration, illustration in agriculture. And past use chemical, nowadays bio is clearly we can understand what is meant by sustainable development into develop unsustainable to sustainable. Next is that urban problems related to energy. Students, as we know that city is a major issue, cause the pollution, air pollution, water pollution, as well as damage the ozone. When you go to Chennai, the ozones are polluted by river, which is filled with this contaminated water due to lack of planning for water purification and water management. So that's the second section we are going to detail about urban problems related to energy. Urban only use enormous energy. Urban housing use lot of energy than traditional housing. Then handle temperature change better than concrete, glass, steel, ultra modern buildings. Energy is an essential need of man, wherever the lives urban or rural society. In urban areas, the need of energy is increasing. Then embedded energy. Material like iron, glass, aluminum, steel, cement, marble, which are used in urban houses, are very energy intensive. The process of extraction, refinement, fabrication, and delivery are all energy consuming and added to pollution of earth, air and water, which is called embedded energy. Okay. In urban housing use, these are the materials, steel, chemicals, how to produce steel from the mining, how to produce aluminum, glasses, everything is industry, work, chemicals use, gas, poisonous gases use, is emit in the environment, damage the soil, etc. The energy consumed in the process is called embedded energy. Industrialized developed countries used energy for these purposes: residential and commercial purpose, industrial and transportation. The transportation mainly fuel use. This emit carbon monoxide. Industrial as well as. Two sources of energy, as we know that: renewable energy and non-renewable energy. Renewable means we can recycle it. Non-renewable, which is damage the environment. And energy conservation, integrated management system is need. We should have renewable energy as well as non-renewable energy sources available. We need to adopt renewable energy. Biomass energy tapping. Biomass energy means which is a biological processing. Example: solar cooker. No renewable. There is no hazards. It shall utilized based with conventional energy from fuel, thermal, nuclear power, etc. So you need to modify it. Due to high production and energy demanding activities. Next, several hurdles that play in energy conservation. We will be learn next section. Discussed about that principles of practice nursing in environmental and sustainable development. Then sixth unit, social issues. Mainly we need to conceptualize what is mean by sustainable and unsustainable. Unsustainable planning strategy into sustainable planning strategy now. So nowadays every planning should be sustainable by means of various institutions and various report. For example, environmental impact assessment. A project started, what are the environmental impact is there, should be assessed it, etc. Then question. Okay students, thank you for response. Thank you everyone. Have a wonderful day.